Great.
Good morning, everybody. Welcome to today's Foundation Forum call on vaccination efforts in Israel's Arab society. I'm Howard Sohn. I'm up toward the left corner there on my screen anyway, with a too bright a window to the right of my head, your left. Sorry for that. I'm the executive of FOS Foundation and chair of the Foundation Forum. As most of you know, the Foundation Forum is a philanthropies subgroup of the Interagency Task Force on Israeli Arab issues. It's dedicated to in-depth learning together about major socioeconomic issues facing Israel's Arab society, issues that often constitute barriers to full equality and inclusion. Today's call came together as reports came in that Israel's fast-paced rollout of the coronavirus vaccine, which has now reached roughly 1/3 of the entire population, is facing challenges in reaching Arab communities. Recent data shows that roughly 56% of Arab citizens over 60 have been vaccinated, but this average masks a very large difference between regions, with the South especially far behind. Already the Arab population has been hard hit by the crisis, by the coronavirus crisis, both in the number of infections and in economic impact. A lag in the immunization in the Arab population carries the risk of further widening gaps already widened by the larger crisis, and leaving Arab society further behind in an Israeli recovery. Many American Jewish foundations have expressed interest and concern about why these gaps emerged and how they can be bridged. And personally, I've been getting questions out here in the San Francisco Bay Area from friends, another just this weekend from a fellow mountain biker, about how Arab citizens are faring in the pandemic and in the vaccination program in particular. So I'm welcoming the expertise we have here today and expect to go back to my friends well armed after this session. We're very fortunate today to have with us 4 expert guests who can share their insights, both national from both national and regional perspectives. Tomer Lotan, Chief of Staff of Magen Israel, Israel's national COVID-19 headquarters, is with us. Also, Adi Ben Mordecai, Director of Public Participation at the Health Ministry. Dr. Mohammad, Khatib, Head of the Health Committee at the National Council of Arab Mayors and a lecturer in health education and promotion at Tzvat Academic College. And finally, Dr. Naim Abu Freiha, Director of the Association of Arab Doctors in the Negev and a practicing physician at Soroka Hospital. So before they begin, I should say, with their short presentations, I'd like to ask Liron to say a few words about today's program and the one scheduled for this Thursday that will focus more broadly than this one on public health generally. So Liron, please help us bridge to the speakers.
Thank you so much, Howard, and thank you for graciously chairing the Foundation Forum and stepping into the shoes as second chair ever of this forum. Really very much appreciate it. Welcome, everyone, and thank you to the SVF for co-sponsoring this event. We have a packed program, so just 2 logistical but important thoughts. First, as Howard said, this call came together in response to urgent concerns about vaccinations, but the focus on public health has been rising before the pandemic in Israel and is now a major socioeconomic priority in the midst of the pandemic. We had initially planned to have a call on public health gaps as our first call of the year, also in lieu of an annual Foundation Forum meeting. this issue, which was nearly absent from government resolution 922, is now not only a major priority because of COVID, but because it intersects with nearly all socioeconomic development goals, from early childhood to higher education, infrastructure development, anchor institutions, and more. So this call today puts vaccinations into the public health context, and the call on Thursday will go deeper into the larger issues. All that is to say, if you have not done that so already, please register and join us for that call. I'll put a link in the chat for that registration. The second point is to really close to my heart. This is the first Foundation Forum call that has been put together as with a new task force team. It's the first call fully put together by all of us. And as we had seen at the annual meeting, if you were there, the staff will be on chat answering questions during the presentation. And Ilan Fathi, the Israel representative, who's also a public health expert, will join in the Q&A. So with no further ado, we are delighted and greatly appreciate that Tomer Lotan is here with us today. He is Chief of Staff of Magen Israel, Israel's national coronavirus headquarters. He is working 24/7 and has really just stepped out of a government meeting as Israel exits lockdown. Tomer will provide an overview of Magen Israel's activities in Arab society. Tomer, the floor is yours. Thank you very much.
Hi, Erev Tov. Good evening, Masal Khair, everybody. Very happy to be here. As mentioned, this is kind of a very dramatic day for us, so sorry in advance for not being as structured and coherent as I usually try to be. But I would just say to begin, just for the beginning, that this is we're currently at a point which is a very delicate time for us in fighting the pandemic. The reason is that we're having this kind of I would say, crucial dilemma on our shoulders. On one hand, we're facing the highest level of disease that we've gone through so far, what we call the third wave of the pandemic. And this is hitting us quite bad, with more than 1,200 severe cases in our hospitals, about 6,500 average day cases. And these are very high numbers, which we weren't used to them over the past year. So we're currently in one of the most I would say challenging points in fighting the pandemic. We're pretty sure that the British variant of the virus has spreaded here in over 80 to 90% of the new cases. And this is kind of a new ball game for fighting the pandemic. But on the other side, we are having this impressive and large-scale vaccination project, which so far has gone quite well, quite quickly, and with very satisfying results. But the fact is that when you put those two vectors together, you get to a point which is very, very difficult to convince and to hold the public attention and the public compliance to keep on with us over the coming weeks or months to go through this challenging time. Not to mention the fact that we're going to the elections very, very soon, and the fragmentation of the political arena is also affecting the decision making and makes our work even more complex and hard. And after saying all this, I think we're very proud in what we've achieved so far in kind of building, establishing, or promoting some of the major infrastructures for fighting the pandemic. Over the past 6-7 months, we've been deeply involved in creating those platforms. One of them is what we call the Ramzor, the traffic light system, in which we use to to maneuver or to handle the resource allocation to the different regions. We also put a lot of effort on issues such as epidemiological investigations and what we call קטיעת שרשראות, I don't know how to say it in English, and also many others elements of defense from the virus which weren't properly handled by the ministries or by the state so far. But after saying all this, I think that one of the conclusions that we got to about 5, 4, 6 months ago is the fact that even if we believe that we're doing our role properly, and even if we achieve our goals, there is still kind of a last mile that is not that well reached by the ministerial or the governmental work. And that is the place in which the community and the civil society and the local authorities are playing a much more important role than what we're doing here. So one of the elements or one of the principles that we've been trying to anchor over those months was to create those bridges, those networks between us, the headquarters, the different governmental ministries, and mainly the Ministry of Health, to those, I would say, civil, municipal, and community networks that are very, very useful in promoting the major steps that we go through. So over those months, and Adi, I guess, will elaborate about it more thoroughly when she speaks. But that was basically we went through different kind of missions to those networks, from improving public compliance to the different limitations that came from government, going through lifting or improving the compliance or the will of people to have corona tests. That was one of the major barriers that we went through. And now our main focus, our greatest focus, is on the vaccination project. As Howard mentioned, the numbers are quite high in comparison to the world. But if you look at the numbers, then you can very easily spot the gaps or the inequality that exists in the Israeli society. If you know what, I think that I can share with you one of the slides that we've shown to the government in the last meeting that was last night, in which you can very easily see those gaps or those the differences between the different sectors. Can you see that? Can you see the screen?
Again,
yeah.
can see.
Yeah, okay, so what you can see here, I'll try to translate it, is 4 different diagrams. The right bottom one, this one, is showing the numbers of over the age of 60, a population that got vaccinated. This dark blue here with 69% is the people that already had 2 doses of the vaccination, and they are completely vaccinated. The medium blue here, which is 10% more population, is people who got only the first dose, but there are 2 weeks after the first dose, so they're in between the first and the second. And the very light blue here is people who only just got the first one. And so what you can see here is that we got only 12% of the population above 60 above the age of 60 that still needs to be vaccinated. But then when you break this, this is like total population over 60, but when you break it into the different sectors, you can see the differences. On the left, on the high left, you can see the what we call the general sector, which is Jews who are not Orthodox and not and obviously not Arabs. So these are very, very high numbers, very close to 90, almost over 90%. But look at those two other diagrams here. The right, the upper right here is the ultra-Orthodox society with about 1/3, 33% of this population which has not been vaccinated yet, and the major gap that we see today is in the Arab sector, which is here at the left bottom. As you can see, almost 40% of this group has not vaccinated yet, and this is obviously a very huge difference from the rest of the society. So and if you go to the next slide, I don't know if I can show you that. These are the same diagrams regarding to the total population, not over 60, but the total population. Here we also added in gray the children under the age of 16. So basically here you can see again the white part of the diagram is the potential vaccination population that has not been vaccinated yet. And again, going back to, again, we get into the same conclusion that in the Arab sector, we have the most, the deepest gap or the deepest inequality in comparison to the others. So obviously, the Arab sector is our target, our main target today, and mainly people over 60 and over 50 in this population. And we've put a lot of effort in this, mainly on the supply side. The supply side is, I can tell you, very, I would say very certainly that this part of the equation is well handled. I mean, we know how to get into most of the places with vaccination branches or with the work of Kupot HaCholim, and to be able to reach to most of the villages, even to East Jerusalem, and we do it quite well. The major problem that we see is on the demand side. And that is, I mean, just before saying that it's not that there is not much to improve on the supply side. We try to improve ourselves every day to spread those branches or those, how to call it, vaccination locations properly, to work closely with the mayors and with the local leadership in order to be in the right place at the right time. However, we know that on the demand side, we are facing a greater problem than the other sectors in Israel. We know that we face criticism, we face fear, we face mistrust, we face a huge phenomena of fake news around the vaccinations, spread it in the social networks, and we try to fight it as much as we can. However, as I mentioned before, when you try to do that in conventional governmental tools, you do it not as good as the community. And the community is the major key, the major element that is needed here for us to be able to complete this project or this process in those sectors. I think that, and again, Adi will tell you about that more in depth, but I think that there is a progress with the work of the organizations and the volunteers, but this work needs resources, needs to be thickened and to be properly handled. And to be honest, this is something that, and I'm coming from the civil society, and so I can, and also from government, and so I can say it quite, to be quite certain in what I'm saying. I'm pretty sure that philanthropy should step in. The ability of entities such as Magen Israel or even the huge Ministry of Health to work with this particular group of volunteers in East Jerusalem, and this particular group of elderly working in Sachnin, and working with the youth organization or group working in Rahat or in Kseife is not well handled from here. And this work should be connected in the ways that civil society knows how to take a mission and to work strongly and thoroughly in order to get it. And what we're trying to do over the past weeks or months is to feed this network and to help it with data, with directives, with policy, with ideas. However, I think that this is not enough, and we need to have this network growing and prospering and supporting those steps that we're taking. So I don't know if that was coherent enough, but basically this is our mission today, and I really hope that this conversation will contribute to make this happen. Again, thank you so much for having the time and the attention and the willingness to to step into this major national mission. And I also just on a personal level that I see myself as an asset for you to make this happen. So feel free through Adi or through Ilan to approach and to any kind of assistance that needed in order to make this happen. Thank you.
Thank you so much, and thank you for your time, for the overview. I think that this is exactly the point of focus that we wanted to bring to the surface, which is that, yes, there's the government national level, but that the barriers are so complex sometimes to get into Arab society that we're really trying to understand about the interface of where this level meets the field. And I think this is why we have the range of callers. Because of time, thank you so much. I'm going to quickly jump to the next speaker, Adi, who is the head of public engagement at the Ministry of Health. And I think that, Adi, from your perspective, I know the Ministry of Health has developed some mechanisms to try to work more closely with the field. And we would love to hear what that has looked like and what your experience has been. A few minutes from you, and then we'll have Dr. Mohammad Khatib and Dr. Naim Freiha from the North and South perspectives. Thank you so much. Adi, the floor is yours.
Thank you very much. So good morning or good evening, depends where you are. So I'm happy to be here today, and I would add a few more words after Tomer's speech, but I would share my screen. Just a second. Can you see my screen? Okay, great. So I want to tell you a little bit about the civic network for the fight against Corona, which we established in last October. As Tomer mentioned, we understood that in order to face this very, very difficult situation, we need to work side by side with the civil society with the NGOs who do a very, very hard and important work all over the years, all the time, and now especially also in communities who has, as Tomer mentioned, mistrust with the institutes, with the government. So we decided we should, as I said, work side by side with the grassroots initiatives and support them. So we have lots of partners, lots of people who are in this network. There are people who care about the situation. There are municipalities, NGOs, and local community leaders, all kinds of people who try to make the combat against Corona better. And in the past few weeks, we established a fund supporting voluntary and community initiatives to combat Corona, as I said, and we got more than 400 requests for funding. 60% of the initiatives of the requests were encouraging the public to keep the social distancing guidelines. I don't know how it is in America, even though I have mother and father-in-law over there, but it depends where you are at. So here it's a very, very important tool in order to face this situation. And 30% of the initiatives were to promote vaccinations, as Tomer mentioned. So part of this is in Hebrew, but as you can see, 99, like about a quarter of the requests were Arab community initiatives, 65 promoting social distancing guidelines, 27 promoting vaccination, and 7, which is I think important. It's not what we deal with, but it was very, very heartwarming to prevent loneliness of people, mostly senior citizens. As you can see, most of it were in northern Israel and in the southeast and southern Israel were the rest. And we funded we were able to fund 25% of the requests. Here you can see, this is the whole project, but you can see the initiatives all over Israel. And as Tomer mentioned, for us, it's very, very important. We understand, even maybe we should do a better job, okay? Maybe we have a lot of things. I'll stop the screen sharing to see you, but there are some things we need to improve. But even if we were perfect, I think we should work together with the civil society, with the NGOs, with the people, the communities. And I think the Arab community is the one that, as Tomer mentioned before, needs the most. I think needs us to give her our hand and work side by side better. I just to conclude my speech, I would just want to say that what we see here is not different than what we see in all the healthcare situation regarding the Arab community. We see that there are gaps, and we see that their health is not as good as the rest of the population. So it's not different. But now we are in a battle, in a war, and we need to fight it together. So we're here, we're willing, as Tomer mentioned, to enlarge the support that we give the initiatives, and we work around the clock for it. We put lots of hope in this collaboration. And we hope that one day, the day will be very soon, we'll manage together to deal with this pandemic. So of course, as Tomer mentioned before, I'm here for further questions, maybe not now, maybe later, but whatever you need from us, we're here. So thank you very much.
Thank you, Adi, so much. Again, I think we're starting with the national perspective of what the rollout has been like. I think now we're going to dive into more specifically what the challenges are on the ground of bridging the gap. So I'm not going to take any more time. I'm going to quickly invite Dr. Mohammad Khatib, who is a public health expert and lecturer, to share with us. He's the head of public health at the Higher Arab Follow-up Committee of the Arab Mayors Forum. Dr. Khatib, please. Can you, let me see. Dr. Khatib, I don't hear you, even though you're not.
Yeah,
There
you
we
hear
go.
me now?
Yes.
Okay, thank you. I'm Mohammad Khatib from the Israeli Society, and I'm the director of the RICAS, the Center for Research, Social Research in the Israeli Society, and also the coordinator of the High Committee for Health in the Ministry of Health, and lecturer in the academic in Safat Academic College. I just want to share my short presentation, please. Okay, first of all, I would like to thank all the organizers for this important meeting and for the opportunity given to us to participate and take part in this discussion about the vaccines in the Arab society. In this short presentation, I would like to present some points. How are the Arab community experienced the corona crisis or the corona pandemic over the past year, and to present some data about the differences between the various areas in the Arab community. And finally, I want to discuss some points of about the challenges we faced in fighting this pandemic, and what is our role from our point of view, what our role as civil society and local authorities, and what should be done in order to be more involved and more influential to make the change coming. And that's what I mean to present in this short presentation. This is the data from. First of all, I want to say that this data we are collecting from various resources and organize. This is what part of our role, as we see it as the Israeli Society, to make this data more available for professionals, for the public. And the data here can show us that we also passed 3 waves over the last year. Now we are here in some place here, and we are we have more than 105,000 of positive cases since the beginning of the pandemic. Regarding the percentage of the Arab vaccinated citizens, in general, we are talking now about 18.3% of the Arabs with the first dose of the vaccine, and less than 10% of the Arabs have been vaccinated with the second dose of the vaccine. If we are talking about the people over the age of 60, about 55 of the Arab aged 60 and more are vaccinated in the first dose, and 38% of them, of the Arabs, vaccinated with the second dose. If we look at the main cities in the Arab society, we can see the differences between these cities, and also between the different areas. We can see here that Sakhnin is in the better position than Dalt al-Karmel, Tamra, Shfar'am, Kana, Farkana, Nazareth, and all of them are in the north. All of these cities are in the north, except Baqal Gharbiya. We also ask ourselves why Baqal Gharbiya is in the triangle, in the triangle area. We call the triangle area, it's Mishulash, or the center. Baqal Gharbiya is in the center, in the triangle, even though we can see that it is in a good position regarding these the vaccinations. Tira, Fars Qasim, Al-Fahim, and Taiba, and Kalansawa in the triangle, less than the north. And in the south, we can see that Rahat, the least placed with vaccinations, with 10% only of people that have been vaccinated. So we can see the differences between the main cities, main Arab cities. If we compare the areas, we can see that the north is the best, what we can call the best position, comparing to the other regions or areas in the Arab, with 22.3%, and the triangle is 18.7%, and in the south only about 5% of the people are vaccinated. That was in percentage. Now this in numbers, and we can see the differences also in numbers. But the more important, what is behind these numbers? We can see here the gaps between the Arab population and the general Israeli population. And also the differences within the, which may explain some of the differences. That's mean that we have to use maybe different ways or different tools in order to get and to reach the Arab communities or groups in the different places. The Arab populations also, sorry, even we are in the same community, the same place, we can see the huge differences between areas. Behind these numbers, there is also an information and services systems. That's to say that this is not depending only with the people themselves. We think that, and we believe that this is something that also related to the way that information provided to this community and these people, and also the services. Even we can say that there is a lot of improvement in the last few weeks in providing vaccinations to the people, but at least at the beginning of the process, there was a lot of problems, and vaccinations get to the Arab community a little bit late. So the question is, what was the influence or the effect of the time and the delay of giving the vaccinations. There are 4 challenges of reaching Arab citizens with the vaccine. We think that also we see a big change in the improvement, as I said before, and the accessibility and the availability of the service of vaccines. But at least in the beginning, there was a problem, and we have to think about what it caused. The second challenge is about the way that information given to the people. In this crisis, the digital apps or ways have been used, but we know that the Arabs suffer from low health literacy and low digital literacy. So this way, maybe it's not the good way to use in order to convince or to reach the Arab population. Third, the fear and the misinformation. The crisis, we are talking about two problems. One is inside the Arab community, the problem of trust inside the community, the Arab community. I'm talking about the trust in the local authorities. And also there is another problem, what I call the external trust, the trust in the system and also in the state. So we are suffering from both of these problems, and we have to intervene here also to improve this problem. The last thing is the fake news that we are as civil society organizations fighting all the time against the fake news, but we believe that it's the role of the state. And I'm very happy that in the last few days we began hear about how the state start fighting the fake news, because we believe that some fake news also have to be treated through the courts or other ways, because it's a very, very serious problem. About the role of the civil society organizations and local authorities, we faced the first wave and the second waves, and we improved as civil society organizations that we can do that. We all know about the success in the first wave, and I can say that one of the main reasons is the involvement of the civil societies. For instance, the emergency room in the Galil Society, or the High Committee for Health in the Arab community, were very involved in the process. We made a lot of work, and I think and believe that we have a part in this success in the first wave. Later, in the second and the third waves, we know that these organizations less active, so we have to think how to connect with them. You said that before, and I think that it's very important to reconnect with these organizations. We believe that the state must see the active civil society organizations as real partners and not as enemies. We as civil societies have the role also to see what is wrong, it's not okay, and it's not against the state. It's because we need and we want to make it more effective and to do the right things. But in some phase, in some stage, we felt that the state or the Ministry of Health as I don't know if this is the right word as enemies, but they stopped cooperate with some of these civil societies organizations because of the critics that we did over what is done in the field. They also should serve as supervisors and assistants. We believe that we have this word, and also we consider us as a link and as a connection between the authorities, Ministry of Health, and the states with the Arab audience or the Arab public. At the end, in order to summarize, we believe that there is a real need for more efforts and more work in order to convince Arab people to be vaccinated. And we believe that we can take the responsibility hand by hand with the Ministry of Health, with all the authorities, in order to improve the bad situation in the Arab society relating to the vaccinations. Thank you.
Thank you so much, Dr. Khatib. I think we'll get into more specific questions about the kind of cooperations that have worked or when they haven't. Hopefully we'll have time for that in the Q&A. I think you raised some very interesting points. I would like to invite Dr. Naim Abu Freiha now to zoom us into the South, and maybe we can start to get to those specifics with your presentation. Please, Dr. Abu Freiha, thank you for your patience.
Okay. Good evening, everybody. Thank you for inviting me to participate in this meeting. Elon talked to me 3 weeks ago, and I thought that maybe it will be irrelevant. However, regarding the vaccination, maybe I was too optimistic, and we are working all the time, but without a lot of success. I will make it short, try to make it short. First of all, I want to talk about our association, the Arab Medical Association in the Negev. First of all, short data regarding the population. We talked in the Negev about 280,000 people, Arab Bedouin people. About 50% of the population are younger than age 18. We talk about a semi-nomadic population, which with a huge change of the lifestyle from the semi-nomadic lifestyle to Western lifestyle in the last 2 to 3 decades. It was the urbanization and modernization of the population was too fast. This transition was rapid, and this fast transition as a result had rapid change in the diet, in physical activity, and high incidence of chronic disease like diabetes mellitus, heart disease, infant mortality because of high rate of consanguinity, genetic disease, high rate of obesity, and of course other problems like domestic accident among children, infections disease like brucella, and demolitions of houses, particularly or in the unrecognized villages. We talk that about 40% of the Arab Bedouin population in the Negev are living in unrecognized villages, and we talked about the shanty towns in these regions. There is no official permissions for these villages, no municipal services, no connection to central water, electricity, or telephone service. So all this lack of infrastructure make it very difficult to do anything, not only in the health part. Our Arab Medical Association in the Negev, it was established 5 years ago because of the health status of the population. And we talked. This is our association is a professional registered, independent, apolitical, non-profit association, and our main objective are to raise awareness in and health education in general, and particularly regarding the chronic disease of the population, because we want to improve the health status of the population. We tried and we are working to reduce the health gaps and lags in the health system in the Negev. Other important objective is to work in preventive medicine and to lower the incidence of chronic high prevalent disease, including genetic disease. We are working in cooperation with the university, with Soroka University Medical Center, with the HMOs, with the local councils, with the third sector organization, and of course with the health ministry. This is a lot of.
Dr. Abu Freiha, I'm so sorry to interrupt you. You have the great fortune of being the last speaker, which lets you respond to all the speakers. It also means that we've, as usual, overrun. I'm wondering if I can, get to the vaccination efforts. I think that it's hopefully we will have more time to speak more broadly about public health issues in the Negev in the future.
Okay. Regarding the COVID-19 epidemic outbreak, I think regarding in general the Arab society, Mohammad talked about the different phases with the success in the beginning and then the second and the third wave. However, at the time we had a problem with language, with data and language to the population to give the information in the Arab language. In the beginning, we had problem with access to testing and of the COVID-19, and of course increasing. I will talk about the vaccination and the bearers and why the rate is very low, particularly in the Negev among the Arab Bedouin population. First of all, the access to vaccination, as Mohammad have mentioned, in the beginning it was only in 3 citizens in the Arab population in general, in all Israel. We still don't have enough access to vaccination in some in recognized villages, and the access is not every day, and sometimes people have to wait weeks. It's improved. It was improved. We have more and more access. However, it is still not enough. I hope in the next maybe in days we will have it access in most of the days in most villages. Of course, in the baseline, the gaps of health infrastructure is very bad in some villages, so it's have impact to deal with such outbreak. This is a new vaccination, so a lot of people want to wait. Don't have enough information about the vaccination, not enough awareness and education, and a lot of people want to wait to see what will happen with other people. So awareness is very, very important. There is a lot of people have suspicion regarding the vaccine, particularly regarding the new technique, relative new technique, messenger RNA, maybe have it have an effect of the genetic information and or like so, and the development of the vaccination was too fast for the people, so they want to wait. Trust, particular trust of the system, trust of the government. It's not a problem only for the Arab population. In general, the Israeli population nowadays, there is a lot of reason and factors for that. The number of fake news, it's really so high. Mohammad talked this, I don't want to repeat it. And of course, we still don't have enough access to right information and data. If anyone want now to have the right information regarding the vaccine, will not have it too fast or quick. However, it will be very easy to have access for fake news. People say, particularly young people, maybe better for me to get COVID-19 than to get the vaccination. Maybe it will be only a few days and I will have the infection and don't need the vaccination. And of course, long-term neglected system will have an impact of the vaccination rate. In general, the vaccination rate for the flu or the general vaccination is very, very high, more than 95%. So it's very, very, we cannot understand that why it's now still so low, the rate of the vaccination. We asked ourselves if it's the same among the Arab medical staff in the Negev, and we had a survey, and 380 people participated in the survey, and we have the results here. 71 of the people in the survey had vaccinated, and 11% infected with COVID. So about 82% have vaccinated, and we tell the people, our population, regarding that. What about the near future? If the rate of vaccination is still so low, with a large weddings and celebrities will begin most probably the next or in 2 months. April is Ramadan, the fasting month, and until now, the British variant, the rate of British variant is low in the Arab population in Israel, as it's increasing and increasing. So if all this factor together will continue, I am optimistic. However, on the other side, I'm very, very afraid what will be in the next few months. It was done, a lot of things was done. The health of ministry, the organizations, the local council, but it's still not enough. We have, really, we are very tired. The whole year we are working. The last 2 months, a lot of work regarding the vaccination. However, we don't have other option. We have to continue. We have to invest more and more, particularly in the next time. We have to work regarding the awareness, the access of the vaccination. Maybe it will be Moderna vaccination in the near time in the Negev. Maybe this option will. The local council, it's very heterogeneous, and some of them is working every day regarding the vaccination, and some of them are only sleep, don't think, doing nothing. We are working with the sheikhs in the mosques, and we are with the education system, because nowadays all people can get the vaccination. And of course, we believe that doctor, the family doctor, physician, can have a huge impact of the population. However, they don't have enough time. So we think that it's more and more invest regarding projector of the Arab population in the Negev. Maybe it's needed. Maybe a projector for every village is needed. Of course, a comprehensive plan is needed. I think in one large plan for the whole population in the Negev, and plan for every village and for the Rahat as a city, and we need more and more resources from the government, from the health ministry, and of course from other sides. This is only few picture from our activity in the last 2 weeks. This is, for example, meeting of doctors with Klalit Mankal, director of HMO Klalit. There is another meeting with only one school teacher, about 20 people. There is a live meeting people can ask 3 or 4 doctors, and the people can ask them about the vaccination, about their fear. This is another meeting with teacher, about 300 people. 2 days, yesterday we had a meeting, that's from last week with schools director, about 200 school director in the Negev. Yesterday we had a meeting with the students, school students, about 250 students. We are working all the time, despite we are very, very tired. However, we continue, and I hope that we can. I am optimistic. I think it will take time. However, I am optimistic, and we will can increase this vaccination rate. However, on the other hand, we don't have enough time because of the factors I have mentioned: the low rate of vaccination, weddings, Ramadan. We don't have a lot of time. I hope that the consequence will not so difficult in the near future. Thank you. It was a very short overview from our side.
Thank you so very much. And I think we covered a huge range of subjects. I'm going to ask 1 or 2 questions to get it really specific. Also, I realize it's 2 o'clock. We did hold 15 minutes. If people have to go, I totally understand. We're going to dive into discussion. Dr. Abu Freiha, you gave a couple of examples of what it might actually look like to have a really point of coordination between a national plan and the local plan. You're talking about project directors for regions. You're talking about task forces that would convene local and civil society leadership so that the national plan would be in coordination and aligned with local actors on the ground. Is that a fair summary?
Yes.
Yes. And I'm wondering, Dr. Khatib and Adir Gidi, how, if you had to describe on one foot what the kind of coordination that you're seeking, what is missing from the coordination to make the national plan to the ground meet, and if you had to maybe give an example of something that has worked or how you envision such coordination going forward, if you can each give an example from your perspective. Dr. Khatib, perhaps the Sakhnin example that you shared with me.
Yes, in Sakhnin, we know why in Sakhnin there is a very good success and a high rate of vaccination, because the mayor there is a physician from the Klalit Kupat Kholim, so he have the influence and he have the power in order to recruit enough vaccinations in short period. So the result is what we have seen, that in Sakhnin there is a very high rate of vaccinations. I think that family physicians have the very critical role. So we have to invest in them. On the other side, I think that we have to develop more and more connections between the NGOs, the civil society organizations, working directly with the people and to connect them with the Ministry of Health. I can't give the emergency room as an example, as a very successful example. That was mainly the connection between the local authorities and the Ministry of Health and the government. And this is a very good model that stopped in some place. Yeah, there is some reasons for that, but we can discuss them. But it's not the time to do that. But I think that it's a very good model, a successful model in order to reach the people and to convince them. The last thing that I think it's very important to talk about the cultural and the social and the linguistical appropriateness of the campaigns done for the Arab population. We talked about developing a staff of experts in cultural issues in order to be more involved in the plans of the Ministry of Health, in order to get more adequate plans for encouraging the people for vaccinations. And as Dr. Abu Freiha said before, we are going in the next few months to Ramadan and the weddings again, and we have to learn from the past and from our previous bad experience in this period. So we have to be prepared and to involve more and more Arab experts from these organizations, not only from these health sectors, also from the society and the political and the economy, and to make this staff as a partner with the Ministry of Health.
Thank you. Adi, I'll ask you the question about what the cooperation looks like on your end, and maybe you can add a layer about local government. We've been talking about civil society, but where does local government fit in their capacities to implement an emergency response like this?
By local government, you mean municipalities, right? Yes. Okay, so I'll give an example of an NGO who we work closely with. It's called Midat. They aim to give facts and data and knowledge about vaccination. And I think having them, who, again, we know how sensitive the vaccinations are amongst the population and how people suspect them. And being an NGO that came from the community, that can speak with the people in their language. I'm not talking about Arabic in particular. I mean, talking to them, looking them in the eyes and say, we are just like you, but we can fight together against fake news. So when we collaborate together, I think we can reach higher levels of vaccinations, but of trust in this whole vaccination campaign. And it's very, very important because we have campaigns all over TV, and we can explain to people, and this is what we do, but some people, it won't be enough for them. And I think that Midat do a very, very good job, and they work now with the Arab community. So this is, I think, referring to your first question. About your second question, we work, my colleague is leading all the municipality collaboration in the Ministry of Health, and we try to work with them because they know exactly what happened in their areas. They know why people behave the way they behave, act the way they act, and they know what solutions to give them. They don't always have all the resources, if I could be frank with you, but working with them as much as we can, I think will help us focus in each community and give each community their solution or their the good solution that they need. So I hope I answered your question.
Thank you. I'm going to take that same question back to Dr. Abu Freiha. And there's a lot of questions on the chat about the difficulty reaching unrecognized villages. And if you can speak a little bit more about the role of local government there, and maybe paint a picture for us about how the civil society, local government, national government collaboration works, and if what you could envision would work. Right now, those are the hardest to reach communities. Tell us a little bit about those challenges and what, if there are any ideas that have given you hope or inspiration as a model that might be able to solve them. Oh, you're still muted.
So there is this, I would say, two types of unrecognized villages. There is this villages recognized about 15 years ago. However, still with very small, little infrastructure. They had, for example, clinics, most of them of the Klalit, the largest HMOs. However, there is still with the logistic problem. For example, there is no electricity all the time in these clinics, and they cannot have vaccination every day. So maybe it will be only one in the week. The other type of unrecognized villages is really unrecognized without any type of infrastructure. So in these villages, it's very difficult to organize the vaccination, particularly the Pfizer vaccination, because this is a lot of things, a lot of preparation, a lot of cooperation between the people, the local people, the HMOs or the MADA, the mobile clinic, how to bring this vaccination to these villages. So until now, there is not appropriate solution for these people. It's very difficult to do that. Maybe in the near future, maybe with the Moderna vaccination, it will be better. However, it's still very, very difficult to do that for the unrecognized villages. In the recognized villages, it's better. However, it's still, we don't have enough cooperation from all parts. I believe that the local council could make a huge change because the local council should be the projector. This is the central role of all others, of the organization, of the Ministry of Health, of the HMOs, and there is some success in maybe 2, 3, or 4 local councils. However, the other, it's really weak and don't work enough. So in this case and in these conditions, we have as organization maybe to take this role and to work more and more and to have the central role to organize all this campaign in the different parts, in the awareness work, in the organization for vaccination, and all different, to be the organizer for all different parts of the campaign.
Thank you. You preempted my closing question, which was to ask, so if a philanthropy is seeking to support vaccination efforts, what qualities should that effort have? Should it have some aspect of coordinating with a local government? Should it have some aspects of multi-stakeholder coordination? That is sort of what I wanted to ask all three of you, because I think that is the underlying question for funders. If they want to help in a vaccination effort, what should they be looking for in a proposal that would not only close vaccination gaps, but strengthen public health infrastructure and coordination in the long term? Do either Adi and Dr. Mohammad have something else to say, to add in closing, because we're really on time?
Yeah, if Dr. Mohammad would like to say before me, be my guest. So I can say really,
sure, please.
that,
Okay.
sorry.
Adi, go ahead, and then Dr.
Okay, I'll go ahead really quickly. I just wanted to say that I'm honored to be here, and it's that, as Tomer mentioned, we're here for you because I think we're dealing with a very, very important mission together. So whatever you need, we're here, and thank you very much.
Okay. Can I talk?
Yes,
Okay.
please.
Yes. I think in order to summarize this part of discussion about the cooperation between the local authorities and the Ministry of Health and other organizations, I believe that we need a model of work. Like during the second wave, there was a model of work in fighting the corona, not focused in some in special issues, and it was very, very successful. In Kafar Qasim, for instance, this worked very, very well. Now, I believe that we need a model of work focused on vaccinations that can make the connection between the three organizations: the local council, the local organizations, civil social organizations, and the Ministry of Health, in order to make efforts on, especially on the vaccinations. And we can do that. We can make can build this model, and this model have to be implemented in all over the Arab communities, in the different local councils. And we have the experience. We have the knowledge from this very difficult year, and we can do that. And I think that we have to start to do that.
Thank you very much. On that note, we're over time, and I want to thank everyone who stayed with us for an hour and 20 minutes nearly. And thank you for all the speakers who, at this very busy time, shared their insights. I want to encourage everyone to come to the Thursday's call, where we're looking at public health gaps broadly and the work of the government and the medical establishment to address them for the long term. Howard, would you like to graciously close the call?
I'd just like to thank everyone, to thank the presenters who offered lots of insights. I think we all come away with a better understanding, and thanks to all the participants, and hope to see you Thursday.
Bye-bye, everyone.
Bye, everybody. Thank you.
Bye-bye.
Thank you so much.